Okay, so this field tends to attract people who are maybe a little more on the sensitive side. I know I'm very self-critical and some confidence issues. How do you, or did you have an experience with anything like that, like self-doubt going through the process? And how did you handle that negative self-talk that gets in the way?
Well, I think generally first, we always encourage, that's why all of our classes really have the infused component of self of the therapist, being able to explore our own family of origin, our own heritage, our own perceptions, our own beliefs, our own views on things, how we feel, and also just being able to gauge when our mental health may be struggling too. So sometimes, we'll coin the term wounded healer. So if we ourselves have had difficult experiences, it's really important to engage in therapy ourselves, knowing what it's like to be in that seat. And that was a part of my program, is being able to engage in personal growth, and I know we do that here, so that I know my blind spots. I know when I'm struggling, maybe I need to not take on so many cases or certain types of cases if I'm really struggling. And so I have engaged in personal growth myself through my program, and it really helped me to see, okay, maybe this population would be pretty difficult for you right now. Maybe down the line it might be better or easier, but personal growth or just personal therapy will help you gauge that. And then I would say not feeling confident, wondering what am I doing, what's the next right thing to say, is very, very normal. So there's a lot of research on just counselors in training and their experiences and just the developmental process. You do see high levels of self-criticism, self-monitoring, self-doubt, and it starts to subside as you learn more skills and you feel more comfortable with the relationship with the client in the room. And so once you just start building those relationships and you have that supervision and that guidance, try this out, next time you go in, try this treatment approach, you start to build self-efficacy, the belief that you can do this and that you are doing this well and right. And I always say the more we know, the more I grow, the less I know, because I'll think, I know how to treat this, but then the client maybe throws a curveball and I don't know how to treat that, or I've never seen that before. So I think finally just being open to lifelong learning. This is a lifelong learning process, and we are never, at that point of, okay, we are completely competent, we're completely able to treat anything. We always strive to be culturally curious or culturally sensitive. And I think that works for us too, being able to just be curious in the approach that we have, and being open to learning as a lifelong goal. So it probably never goes away, but it definitely doesn't have as much of a presence as you learn more skills.
Excellent. I think it's a perfect place to stop.
Awesome.
Yeah, thank you so much.
Okay, you're so welcome.
That was great. All right, we're rolling. So we'll just start with just in general. You know what this assignment's about, is advice to aspiring therapists. In general, what would your advice be to someone who's just starting the process?
Just starting as in graduating and getting into...
Yeah, well, starting school, starting a master's program.
Gotcha.
like I am.
I would say don't compare yourself. Don't compare where you are in the process to anyone else. Yeah.
Can you turn off the sound machine up there?
Yeah, sure.
Yeah.
Sorry about
that. was good.
Yeah. I can turn it.
Yeah, I can hear that too.
Yeah, sure.
All right, you ready?
I am ready.
Okay, so I will ask the question. What would your advice be to someone like me who's just starting graduate school and is aspiring to be a therapist?
My advice would be to not compare yourself to anyone else. It's really hard not to do that. But I remember when I started out in the program, it was really easy for me to compare my process and where I was in the program to everyone else. And so my advice would be really just try to avoid doing that, because it will work out the way it's supposed to. For me, it took more than, a lot longer than I thought it would to get through the program. So definitely just focus on yourself and your self-care. that would be another thing. Making sure that you're taking care of yourself mentally, emotionally, physically, all the above, because it gets to be a lot, especially in this field. So that's important.
Great. Okay. Is there anything that you identified that was missing from your academic training, or is there something that we as students should be asking ourselves that we may not be thinking about?
So to be honest with you, I feel like this program sets you up academically. You know, I feel confident in terms of everything that we learned, that as you get into practice, you can see any client that walks in the door. Now, with that being said, the more that you experience, you know, clients, because it's one thing to look at a book and read something, but to see it face to face, you know, but getting that experience is really important. So you're going to learn so much. But I'm confident, you know, in saying that our program prepares us for all of that. I even saw that when I was in grad school working in a call center, working with clinicians who, you know, social workers, LPCs, and I started seeing that they had limited knowledge of things that we were already learning. So academically, I can't think of anything else off the top of my head. I just think that the more experience that you have getting, you know, in the clinic, in your externship, you know, take advantage of that. And, you know, even if it's something you don't necessarily enjoy, you know, try it out, and you learn a lot just from seeing clients face to face. So.
Okay, so this field attracts people that are sensitive and you know, maybe having some feelings of insecurity.
Mm-hmm.
How did you handle those thoughts, or maybe some negative self-talk, when you were first starting out?
So when I first started out, getting into the program especially, and then, you know, getting through the clinic and seeing clients, for me, I was really insecure with my age. I was one of the youngest. The fact that I was not married, did not have kids, anything like that. The question was, you know, how can I help people in marriage and family, you know, if I don't have that myself? But there's something that I feel like something clicked with me. And this is really what helped me feel more secure and more confident in my work. I recognized that it's not my place to give advice, because I'm not the professional of the client's life, they are. So once I kind of understood that, I was able to be more confident and secure in my work, because I wasn't there to give them advice. I was there to be present with them, to help them tap into their own resources and figure out, you know, what's the best situation for them, and help them, you know, learn tools and skills like that. So, okay.
So what is your opinion on sharing a diagnosis with a client? Can it be too stigmatizing? What are your thoughts on that?
Yeah, absolutely. That is one thing you have to really, you know, be careful and mindful of. I do feel like sharing diagnosis can be very helpful and beneficial in terms of helping clients, you know, just understand more about themselves. Something that I like to do with clients is to help them separate who they are versus a diagnosis, instead of it being like, I am this diagnosis. It's, they have it, but who are they in addition to that? So learning, just having a recipe for, you know, treatment for, you know, other people that have gone through something similar. So it kind of helps them, you know, feel like they're not the only one and alone in that. Now on the flip side, you do have to be careful with how you approach that. I would say, for me, what I've seen in my practice is working with personality disorders. That is something, number one, it's rare that I see an individual coming in by themselves with one. Typically it's couples, families, spouses, something like that. But a rule of thumb would be not to use a diagnosis with a personality disorder unless a client suggested it themselves or brought it up themselves.